Hello and assalamualaikum everyone. Today we will discussing about a critical issue that affect all of us, which is rising healthcare costs. This isn't just a local problem, but it is a global challenge impacting individual governments and also organizations worldwide. So let's explore why this is such an urgent matter. Over the past few decades, healthcare costs have been rising significantly, often outpacing inflation and wages. This increasing costs strain household budgets, disrupt healthcare providers' operations, and create challenges for governments trying to manage their healthcare system. This isn't just about finance. Rising costs have a broader impact on both our economy and social well-being. When healthcare becomes expensive, people delay or avoid seeking treatment, leading to worse health outcomes. For government, high costs mean diverting resources that could have been used for education or infrastructure. The healthcare system is vital to everyone, and its financial instability can ripple across society. The issue is complex and multifaceted. It's driven by various factors such as advancement in medical technology, which improve care but come with high development and implementation costs, an aging population requiring more frequent and specialized care, a rise in chronic diseases due to modern lifestyle, and policy and regulatory environment that can inadvertently increase costs. This complexity makes it clear there is no single solution to the problems. Because of these challenges, collaboration is crucial. Government, healthcare providers, insurers, and patients must work together to develop effective solutions. Addressing rising costs requires balancing and affordability with maintaining high quality care. So, to create a sustainable and equitable healthcare system, innovative solutions are necessary. This include reforming healthcare policies to make system more efficient, expanding access to preventive care and insurance coverage, introducing care models that prioritize both affordability and quality. Furthermore, we need to ensure this solution address disparities in access, particularly for underserved and low-income population. In summary, rising healthcare costs are a pressing issue that require urgent and collaborative effort to address. In the next section, we will dive deeper to the specific costs driving this cost and explore possible solutions. So let's move to the next presenter. Thank you.
Tinagarin. My metric number is 287090. For today, my part is causes of rising health costs. So, for the first point is advancement in medical technology. Advancement in medical technology such as robotic assisted surgeries and imaging tools like MRI and CT scans have greatly improved healthcare by enhancing diagnosis accuracy and treatment outcomes. However, these innovations come with high costs, including significant investment in research, high costs including equipment. For example, developing new technology can exceed of 100 million over and treatment like CAR, T, cells therapy and cost of per cycle. While these technology improve patient care, their expenses raise concern about the accessibility and long-term sustainable of healthcare. For the second point, population. The aging population is a significant challenge for healthcare system worldwide. By 2050, it is estimated that 22% of the global population will be age 60 over older. This demographic shift has lead to an increase in age-related health issues such as chronic condition like arthritis, diabetic, cardiovascular disease, which require long-term care and frequently medicated attention. Additionally, neurological illness like Alzheimer's and dementia are becoming more common, demanding specialized and often expensive care. Research shows that healthcare spending for individuals aged 65 and older is 3 to 5 times higher than the younger age groups. Many older adults are required nursing home, assisted living facilities on in-home care, placing future financial strain on resources. To address these challenges, government and healthcare system must develop sustainable strategy to meet the unique needs of the aging population while managing costs effectively. The last part, which is the increasing prevalence of chronic illness, is a major contributor to rising global healthcare causes. Chronic disease such as diabetic cancer, health disease, and respiratory disorders account for 70% of global deaths. Unhealthy lifestyle choices, including smoking, poor diet, and physical inactivity, are significant factors driving this condition. For example, the global obesity rate are tripled since 1975, leading a rise of diabetes and cardiovascular disorder. To address these challenges, prevention initiatives such as public health campaign promoting exercise and health diet are increasingly important. However, the financial burden of chronic illness will remain critical factors in healthcare costs until these initiatives active, which pay lasting impact.
Healthcare costs are rising at an unprecedented rate, placing immense pressure on individuals, families, and national economies. As policymakers, healthcare providers, and communities grapple with this challenge, it is crucial to identify sustainable and impactful solutions. Today, I will discuss three key strategies that can effectively address these rising costs while improving health outcomes that are expanding telehealth and outpatient care, investing in preventive services, and enhancing subsidies and insurance options. Together, these approaches not only reduce financial burdens but also build a more equitable and efficient healthcare system for everyone. Number one, enhance subsidies and insurance options. Expanding and making permanent enhanced subsidies for health insurance marketplaces is a critical solution. These subsidies improve affordability for middle and low income households by reducing premiums and cost sharing obligations. Permanent subsidies under the Affordable Care Act (ACA) have already demonstrated success in increasing insurance coverage while reducing financial strain on families. Furthermore, this approach encourages broader insurance enrollment, stabilizing insurance markets, and mitigating uncompensated care costs, which ultimately lowers overall healthcare expenditures. Number two, telehealth and outpatient care. The expansion of telehealth and outpatient care offers a cost-effective alternative to traditional healthcare delivery. Telehealth reduces costs by minimizing hospital visits, leveraging technology for consultants, and expanding access to care in rural and underserved areas. Similarly, outpatient care provides lower cost settings for non-critical procedures, reducing the financial and logistical burdens of inpatient care. Post-pandemic, these models have become integral in healthcare, helping providers meet patient demands more efficiently while controlling costs. Number three, investing in preventive care. Prioritizing preventive care is a long-term solution to reducing healthcare costs by mitigating the need for expensive treatments. Early intervention through screenings, vaccinations, and wellness programs help manage chronic diseases more effectively and prevents the escalation of conditions that require costly interventions. Preventive care improves population health outcomes, reduces the economic burden of untreated illnesses, and aligns with public health goals to create a healthier and more productive society.
Assalamualaikum, my name is Muhammad Haikam Melmi and my matric number is 287375. At my part, I want to talk about challenge and limitation when the increase of healthcare financing. First, the main point is household. The rising cost of healthcare significant impact to household, challenging their financial stability and access to essential medical service. Families are forced to allocate more of their income to healthcare, often at the expense of education, housing, and saving, weakening their long-term financial foundation. For low-income households, the burden is even greater, raising costs of often leading to delay of skip medical treatment, as affordability becomes a critical barrier. This creates a various cycle where financial strains worse health outcomes, leading to higher long-term costs and further economic challenge. And the second point is employers. Employers face significant challenge as rising insurance premium and medical expense strain their operational budgets. For SME, this struggle is particularly severe as they work of offer competitive healthcare benefit while maintaining profitability. Globally, the rising cost of health benefit is a pressing issue, as highlighted by the ILO 2022, in Malaysia, their costs are further aggravated by inflation, growing demand for private healthcare and the adoption of costly medical technology. Ultimately, the trends employers will be impact profitability and their ability to provide comprehensive benefit, reduce their competitiveness in the labour market. Alright, continue our presentation at the point number 3, which is a non-communicable disease. The rising medical costs in Malaysia are profoundly impacting patients, particularly those with chronic non-communicable disease like breast cancer. Treatment for breast cancer alone range from RM18,000 to 36,000 ringgit. But this figure don't include hidden costs like travel, post-surgery rehabilitation, medication, and follow-up the doctor. This cumulative expense often lead to borrowing money, depleting saving, or even skipping treatment altogether. This financial strain does just affect their physical health. It's a toll on mental well-being, compounding the stress or battling a life-threatening illness with overwhelming financial challenge. And then the last point is a government challenge. Rising healthcare costs present significant challenge for government, particularly in promoting preventive measures and healthier lifestyle. In Malaysia, initiatives like the War on Sugar campaign, the sugar sweetener beverage tax, and the Nutrigates labeling system aim to encourage healthier choice by providing clear information about sugar and salt content in foods. This measure help raise awareness about the risks of unhealthy diets such as diabetes and hypertension. That's all from me. Thank you.
Assalamualaikum and having good days everyone. My name is Muhammad Aizul Husni Muhammad Kamal. My matric number is 287204. Right now we go to the conclusion part. To conclude this part, I will sum up all the things in this study from causes, solutions and challenges in rising healthcare issues. Cause of rising healthcare we can see at the 3 points. The first one is advance in medical technology that can provide more and faster medicine or therapy that patients need. Besides that, rising in elderly population. As we know, majority of elderly having chronic diseases like cancer and high blood pressures that need more complex treatment to treat it. Finally, inappropriate lifestyles and diet like smoking and unhealthy food can lead to this problem. In terms of solutions, also have 3 points. The first one is increase of subsidies and options of insurance that can help to obtain the best treatment at the lowest cost. Next, telehealth and outpatient that using technology to get the treatment. And for the last one, investing in prevention because prevention is better than cure because our spending in prevention is cheaper than get the treatment. Last but not least, this study also discuss about the challenges that facing about this issue. One of the issue is NCD diseases like cancer and stroke that need continuous treatment. Besides that, financial funds for health sector from government due to an unpredictable number of patients and type of treatment that they need. The last one is cash flow of company because every employee company must provide health initiative to their staff. So that's all from me. Thank you for lending your ears.